Contracting the coronavirus will generate a level of immunity. The government wants to know the extent of this here, for which an enormous project is being undertaken to test as many people in Gibraltar as possible. As a small and close community, the territory is well suited to share data for international research purposes. 35,000 antibody tests have been ordered from manufacturer Abbot, which are considered to be reliable. The tests take the form of a blood test, which will be offered to all local residents as well as to cross-frontier workers. It's expected that up to 500 tests will be carried out every day, as soon as the test kits are delivered next month. Clinical and laboratory teams are already being assembled, and a contact system is being set up. Given that blood tests require consent, they will be voluntary, although the authorities are hopeful that most people will agree to undergo the test, the results of which will help understand Gibraltar as a community and not necessarily as individuals. The focus now is very much on testing in an attempt to keep the virus at bay. We've been successful so far, for which the Nightingale Field Hospital will shortly be mothballed, as the 238 beds available there far exceed the cases detected locally. Although it will not be fully dismantled, some hospital equipment and bedding will be packed up and stored, leaving only more complex systems on site should Nightingale need to be reactivated urgently. This ties in with the resumption of clinical services at St Bernard's. Early review screenings will be the first to start, followed by normal screening services with the aim of having the hospital back to normal by the 3rd of July. It's yet to be determined how the UK's plans to introduce a quarantine period for people arriving in that country by air will affect Gibraltar. Representations have been made at the highest level, with the low numbers of travellers from the ROC also strengthening the case for exemption. However, in Spain, a 14-day period of quarantine for people arriving in the neighbouring country is coming into force, but will currently have limited effect in Gibraltar, as Spanish nationals, foreigners with residency in Spain, frontier workers and diplomats are exempt. Very few others are allowed through the border at this time. Over 14% of the Gibraltar population has already been tested for Covid-19, with just 147 confirmed cases, 3 of which are active and at home. It means that lockdown has so far worked, but the virus continues to be amongst us as it is around the world.
All this means one thing: the global pandemic is not over. Gibraltar has won the first battle, but we have still to win the war. Yet at the same time, there is always hope. Our aim was to flatten the curve. In our typical Gibraltarian way, we not only flattened the curve, we flattened the virus as well. And the truth is that the GHA are better prepared than ever before.
The ROC is being unlocked through a slow and gradual process over a number of weeks. But one thing is certain: we cannot turn the clock back to February, and we now have to do things differently, for which we will all need to adapt and move forward to a new world for as long as necessary.